A massive spike in flu cases in Erie County over the past week, shown in this graph from the health department. The graph shows week-to-week flu cases for this year, last year in 2012. This year is in green. That spike representing twice as many flu patients now at local hospitals this week as compared to last week. And tonight, health department officials say they think they know why. 7 Eyewitness News reporter Ed Dranch has the latest tonight.
And Keith, if you're feeling sick with flu-like symptoms, you're certainly not alone. Brand new tonight, we've learned the flu shot out this year does not necessarily protect against the type of flu many people have.
We've had a huge surge.
Dr. David Pierce says doctors and nurses at Millard Fillmore Suburban Hospital are working overtime around the clock trying to deal with the masses coming in with flu-like symptoms, many of whom have tested positive for the flu.
It's across the entire system, so everyone is being hit very hard at this time of the year with influenza.
Data released by the Erie County Department of Health shows a nearly 130% spike in reported flu cases in just 1 week alone.
Right now we are in what would normally be one of the highest peaks for influenza in general. Why it's higher in this year as opposed to the last 2 years, I don't know.
This year, Pierce says the flu shot does not necessarily cover some of the strains of flu folks are coming down with. But he says this strain does not compare to the H1N1 swine flu from 2009, which was also not covered in that season's flu shot.
The regular flu, even though we have a higher than usual peak at this time of the year, is still not an epidemic. It's still influenza, and it's expected to have a higher proportion at this time of the year, although we are seeing more cases than in the previous years.
Still, doctors are urging those who have not yet been vaccinated to get this season's shot, healthcare providers included. At Suburban Hospital, doctors and nurses with direct patient contact need to have the flu shot. Others are made to wear masks for their protection and for the patients. Masks, tissues, and hand sanitizer greet patients at the door in an effort to minimize the spread of germs during what seems to be a higher than average flu season. So bottom line here, if you feel like you have the flu, doctors say don't just go to the hospital. Instead, call your primary care doctor first. Most flu cases can simply be treated with time and rest at home and don't need emergency attention. Reporting live tonight, Ed Dranch, 7 Eyewitness News.